Okay, so this week we're going to be doing NHS versus private services in dentistry. So we're going to be going through appointments, dentist-patient relationships, prices, availability, and appointment nature. So the first thing is about appointment times. So in the NHS, appointment times are normally very short. So if you would have maybe 15 minutes for an appointment in the NHS, you'll probably get about around double that, around half an hour in a private surgery. This also helps the dentist to calm the patient down and also build their trust as well when it comes to the whole procedure, since some patients can be a bit apprehensive. This also allows a better quality of work, and because there's no funding limitations in the private sector, and also there's no waiting time. So when I went on work experience, I found that one of the patients, he wanted his braces to be done at the same time as his friends because he didn't want it to be done later, even though he was eligible for the NHS waiting list. But it took about 2 years to actually have your time. So he went private and he did all of them. He put his braces on like at the same time. And also it ties into dentist-patient relationships, where, as I said before, it builds trust and also a type of understanding between dentist and the patient. So more on dentist-patient relationships is that when a patient comes in to get their procedures done, the dentist has the ability to talk to a patient, learn more about their life. More on dentist-patient relationships is that the dentist has the ability to build more trust with their patient and also gain more knowledge about their life, which could also lead into their case. So if they know more about their life, they know more about their habits and maybe any stresses that are going on in their life, and that also helps them and how better to help them achieve what they want. Also, in private surgeries, you have more time to talk the patient through what you're doing, which again builds trust. And that can solve any problems and alleviate any type of pressures that the patient may have. And also, along with this, since the dentist has enough time to actually converse with the patient, they get more of a sense of reward, since you know the patient on a more personal level and you can see their confidence build over time, and that also helps you when, obviously, if you're working in the private sector. Last thing is on prices, where in the NHS, obviously, you have limited funding because of the amount of people that there are, and it's all like government funded. And in private surgeries, there aren't any funding restrictions, so there wouldn't be any restrictions on the quality or choice of materials that you use in the surgery. And also this accounts for affordability as well, on how some patients may not be able to afford high prices, such as £2,500 on average for private orthodontic treatment with fixed braces, which are basically the metal wires that they put on you. And some people may not be able to afford that. So they may go down the NHS route, which is obviously a longer waiting time. But if you can afford that, then you may want to go down the private sector, in which you actually have the ability to get your work done quicker without a waiting list.
So now I'm going to talk about the availability of appointments and how that compares in private dentist clinics to NHS clinics. So private dentists are costly, as Sabeen just mentioned. However, this is often justifiable because there is an increased availability of appointments. That means that there are shorter waiting times for an appointment and greater flexibility for the appointment. For example, if you're working a 9 to 5, you can get an appointment in the evening, which is more convenient for the patient. And this also means that private dentists can provide immediate emergency care, which is often needed if the NHS is overbooked or understaffed, because at the moment there is actually a shortage of dentists, so they're very high in demand. And private dentists are more available in comparison. NHS dentists often hire private dental specialists because they are more flexible and they provide more treatment options, as they have no limitations on budget. Overall, they are faster and convenient to book with a private dental clinic because the NHS is often overbooked with long waiting lists because they treat a large number of people. So now on to the nature of the appointments. You're more likely to see a private clinic if you need a specific treatment that falls outside the typical guidelines of the NHS or it's not provided, in which case they will refer you to a private clinic if you so wish. For example, if you're getting braces but the way your teeth are don't fit inside the guidelines that NHS provides you free braces, then you have to go to a private dental clinic and they will offer you braces.
Wait, pause for me. Sorry. What the heck are they doing? I don't know. Let's give me this. Sorry.
Oh my god.
Where's my name?
Huh?
Did he write paper?
Yeah, bro, like, I don't know. Okay, whatever.
Sorry.
Do I start
Okay.
from the beginning? Or like,
Just continue from where you left off.
okay. So, for example, if you need braces but your teeth don't fit into the categories or guidelines that allow for free braces, then they might defer you to a private clinic, and that's where they will give you braces just for your teeth. If, like, say they're not completely messed up, just like a little messed up, and you would want braces, then you need to go private.
It's fine. Start again from the sentence. Wait. Can I go quickly? Sorry.
What am I doing?
You can close the door on the way out. Yeah. Thanks.
Did I just say that again?
Just start from the sentence that you stopped at.
Say, for example, that your teeth, they're not completely messed up, but just slightly, and you would like to have braces, but they don't fit inside the NHS guidelines. You need to go to a private clinic that offers braces, and they would give you braces for, but they would charge you for them. And as Sabeen also mentioned, they do not work on a fixed budget, so there's a wide selection.
Come in quick. You close the door, please.
So as Sabeen mentioned, private clinics do not work on a fixed budget. So they offer a wider selection of treatments and usually have more expensive technology and equipment. And their practices offer cosmetic work like veneers, teeth whitening, which are obviously unavailable on the NHS, which treats more immediate emergencies. And private dentists offer more time with patients, which is helpful for treating immediate problems and preventing any further issues, and which is also convenient for the patient. And overall, private dentists, they provide a better quality of care. Mostly, a lot of it is because they're private, you can leave a review on their dental clinic, and that will affect the business as a whole. But if you left a review on an NHS clinic, you could just go to a different NHS clinic. So it impacts private dental practices more than it does NHS. So that's basically it for NHS versus private services. If you guys have any questions, please feel free to ask.